Advice to stop smoking and providing professional support to do so is the single most important intervention a physician like President Vasquez, or a cardiologist, or a general practitioner, a nurse, a community health worker can offer. And it is simple to do. Firstly, we need to ask, and then we need to advise, and finally we need to act. Ask, first of all, are you using any form of tobacco products, either now or in the recent past? Secondly, advise to quit smoking or using any form of tobacco completely. You must stop smoking or it will kill you is not the most helpful behavioral approach, because many patients know the risks associated with smoking. Many are willing to make a quit attempt. And so it's more appropriate to say, can I offer you help to stop smoking completely? And finally, to act, to provide behavioral counseling and support on approaches to stopping smoking, including the use of evidence-based pharmacotherapies, nicotine replacement therapy, and centrally acting drugs such as bupropion and varenicline, which can halve quit rates, and finally to provide follow-up and reinforcement for patients who relapse, to try again, to build on their initial success. And if you're interested in more information on how you can support patients to stop smoking and to reduce smoking in the population at large, the World Heart Federation has published fact sheets on its website for both the patients and the public. Why is advice to stop smoking the single most important intervention that we as health professionals can offer to our patients? Number one, it saves lives. It improves longevity. Secondly, it reduces the risks of another heart attack or stroke and other smoking-related diseases. It also reduces the need for rehospitalization, expensive medical interventions, revascularization procedures, and so on. And finally, it is cost-effective and ultimately cost-saving for the health service. But as we physicians and health workers struggle with our patients to help break the addiction of tobacco, we need a public health context in which to make our work easier. And that is why public legislation on tobacco control and the inspirational work of President Vasquez is so important to the work of cardiologists and physicians like ourselves. The public health agenda is the single most important step towards smoking cessation in the population at large, but we can play our part for our patients as well. Thank you.